probably wondering, who is this and what does he have to do with the competition? Well, this is my younger brother John, and he just recently turned 19, and this picture is from his senior pictures, so a year and a half ago, I believe. And this gives me my second question. Has any of you guys ever heard of psychosis? Okay, so some of you guys have. Maybe you haven't, maybe heard of the term, maybe you don't really understand what it is. But I'm going to show you just a little bit of part of the video. Just like a minute long.
What do you think of when you hear the word psychosis? So what actually is psychosis?
If you go out, you have to actually just cut and paste the link.
Is that
Yeah, so take the link. Yep, oh, there you go.
Oh, is it good now? Okay,
Yep.
sorry, can't see what's on here.
Mental health problem. What do you think of when you hear the word psychosis? So what actually is psychosis? It's a mental health problem that causes someone to perceive or interpret things differently from those around them. Psychosis is surprisingly common. In fact, it affects 1 to 3 out of every 100 people at some point in their lifetime. Symptoms can include seeing things that are not there, hearing voices, losing touch with reality, paranoia, and confused thinking. A person with psychosis may see things that aren't actually there, like people, animals, colors, or shapes. Or they may hear voices that are angry, mean, or sarcastic. Some people may experience auditory hallucinations, where they hear people talking to them or about them, or hear other sounds that other people can't hear.
So the fall of 2016, my brother, during his senior year in high school, experienced his first episode of psychosis. NAMI, which stands for the National Alliance of Mental Illness, states that psychosis is characterized as disruptions to a person's thoughts and perceptions that make it difficult for them to realize what is real and what isn't. So basically, it's being out of touch with reality. In the U.S., approximately 100,000 young people will experience psychosis each year. To go a little more into depth about symptoms, I know the video kind of gave you a background knowledge, but up here is kind of more what it's about. So in early onset, you can kind of see someone become worrisome, trouble concentrating, spending more time alone, disorganized speech. And then the main two kind of symptoms are the hallucinations and delusions, and you've probably heard those symptoms before, probably from like your psychology classes and stuff. But along with like what my brother started experiencing, some of his hallucinations were hearing voices, and his delusions were kind of delusional thoughts about like what he was perceiving or thinking, what people were thinking of him, and just other weird symptoms like that. To go into more, because I kind of just threw a bunch of symptoms at you, and you're probably confused of who gets it, how is it, what kind of people get it, how does it cause. So the main kind of causes that I kind of broke down to were these main three. So the first one is genes. Genetics is huge. Looking at your family history, is there mental illness, is there anxiety, depression that runs through it? And then genes and environment. Author Elaine Walker and Kevin Tessner support the fact that genetic and environmental factors interact with the etiology of some individuals. They can manifest subclinical signs of psychosis. So for my brother, in our family, we do have mental illness does run through, and then it's also the environment, like I said. So for him, it was a very stressful time in his life, where he's a senior, where to go to college. He was captain of sports teams, and all of that mixed together just kind of contributed and manifested to experience these psychotic symptoms. Another one is the trauma. Is there a traumatic event that happened in your life? So that could be a death of a parent, or a divorce, sexual assault, anything that could happen in childhood or something recent. And then the third one that's also huge is substance abuse. In the journal article, author Cecile Henquit and colleagues conducted a cohort study of cannabis use and the predisposition for psychosis and psychotic symptoms. And they found that the exposure to cannabis use during adolescence and young adulthood increases the risk for psychotic symptoms. So if you are abusing marijuana or alcohol, like those sort of things mixed together. All three of these, all combined in one, can just manifest it and trigger this psychosis, and that's kind of like what happened with my brother. So the earlier you catch this matter, the easier it is to diagnose it, to seek help, get better treatment, and better quality of life for an individual. So as far as treatment, there's a lot of different things that can help for treatment, but case management, family support groups, therapy, medication. Family therapy or support groups is super important because it's not just the individual who just needs help, it's the family that needs to understand and people around them how you're supposed to get through something like this. And then medication is also super important. In the Scientific American, Carrie Arnold stated, people recognize having mental health disorders, often prescribed and psychotic drugs, can be very dangerous. So you guys have your own opinions about medication and drugs, but with disorders like this and psychosis, medication is crucial, and you can't just give someone a certain med and be fine the next day. It could help like the psychotic symptoms, but it could also make them very depressed, so that's why it can be dangerous and is kind of a long process with that. So in conclusion, I don't really have the next slide, but I just kind of want to explain to you what are the symptoms, the causes, the treatment, and just for you guys to be aware of like what psychosis is, and just to talk about mental illness and mental health itself, because it is something that's super important. And for you guys to know if like you ever have anyone in your family, friends, or yourself, just to communicate that.
Thank you very much, Lizzie.